Hello. Welcome to Cliniversity.
So the 6 sections of the CPT codebook are in order if I talk about. It is evaluation and management, anesthesiology, surgery, radiology, pathology and laboratory and medicine. Here is, you can see quick look at the sections of category 1 CPT. I'm talking about category 1. So category 1 CPT codes, these are arranged by their numerical ranges. So you can see numerical ranges also, which is covering all the codes under this for evaluation and management. Then other codes are there starting with 00100 and then 01999, and then you can find another range provided for anesthesia only starting with 99100 and 99140. So all the codes under this range will be for anesthesia. All the codes under this range, it is for evaluation and management. Then other range, the next range is for surgery. For any kind of surgical procedure, claim will be made through the codes assigned under this range. That is beginning with 10021 to 69990. So under this, many codes would be there for different kinds of surgical procedure performed at the hospital. As per the report, that particular procedure needs to be cross-checked here, verified here under this surgery or under this chapter. And then accordingly, that specific code will be assigned for that procedure. Then for radiology, this is the range. Pathology and lab, you can see this range. Medicine, all these ranges are there. Now, if we talk about the organization of CPT manual, the same thing is mentioning that this is the section and these are the ranges of codes in this dictionary. Now, in CPT book, we are having certain other types of codes also, which gives specificity to different procedures performed, or maybe giving an additional process if it has been performed in the hospital, like add-on codes. So a plus sign is always used to indicate some add-on codes are there for this particular procedure. And that add-on codes indicate that certain additional facility or process has been done during this existing process, which is required to be paid, right? So that is what plus sign means. Then always used for primary coding. I mean, whenever you are assigning two codes, two different codes, or sometimes three codes are also assigned to cover all the procedures performed for a particular patient at a time. In that case, plus signs needed to be mentioned, and this plus sign will always be there with the primary code. I mean, the one which is mentioned first, and then the other one or two, whatever codes are there, indicating additional procedures performed or provided to subject. Next is modifier. What does modifier means? This is one or more two-digit numbers up to 3 per procedure, and it is assigned to 5-digit main numbers, I mean codes. It indicates that certain special circumstances applies during that procedure that is provided to the subject. So some special circumstances were there for which certain kind of procedure was performed. That is what modifiers indicate when it is added with certain codes. Now, this was about CPT 1, CPT under category 1 we learned. Under category 2 and 3, and there are certain unlisted procedure codes are also there. Category 2 covers or tracks healthcare performance measures, and 3 is about temporary codes for emerging technologies, services, and procedures. Unlisted codes are also there, which are used when no other code is available in that dictionary. But these are used very, very carefully because currently updated version of this dictionary provides all the possible codes for all possible diagnosis or procedures. I mean procedures specifically for CPT. Now, as I told about the first section under this uh, category 1, that is evaluation and management. So this EM codes, this is used for all physicians in any medical specialty. I mean, we are having providers belonging to different specialty, right? So this E&M codes from CPT under category 1 it is used for all physicians, irrespective to which specialty they belong to. Now, the key factors that help to determine level of service they have provided are the extent of the patient history taken, which is recorded in the report, and the extent of the examination conducted, the complexity of the medical decision made. So, all these three are the key factors that define or determine that what level of service would have been provided to the patients. Now, new patient versus established patient, this is the kind of term you must understand. New patient indicates in a report if it is mentioned new patient. So what does this indicate? That this patient not seen by physician within the past 3 years. And if in the report established patient written, so this is indication that indicating that this patient had been seen by the physician or provider within a last 3 years of period. Now, next is the surgical procedural codes. So the surgical package or all the code, whatever provided or the range of the codes provided, it includes all procedures normally a part of an operation. So see, when any operation is happening, anesthesia is something which is mandatorily going to be provided, right? Then whatever surgery needed for accurately, specifically will be coded, and routine follow-up care for that also codes are assigned. So guys, think practically, like you feel like if a patient is getting sick with certain condition, then what all things will happen step by step when they visit to clinic or hospital, and then they are going next to for example, if they are taking any kind of surgery and all, so then what will happen? So that is how we should think practically, and accordingly when you are thinking, you will be able to code all the possible things whatever are possible. I mean whatever is there in the report. Global period is something that is the time period covered for the follow-up care of the patient. If past global period is there, additional services are reported separately, and yes, these services will also be, will also be required to be paid, right? So payment is required for these services. That is why these will be additionally coded. Now, if a patient is suppose admitted in the hospital and undergone certain surgery or something, any other treatment, so in that case, if laboratory procedure is performed, that also sometimes covered under the insurance. I mean, it depends. In India, especially, if I say it depends on the, what kind of insurance company it is. But in US, if we talk about, these things are paid. So laboratory procedures like panels are there, organ or disease oriented. Pathology and laboratory sections of the CPT are there, which will cover all these claims. And if separate codes are used, they will be rebundled and payment may be delayed. So such kind of laboratory procedures, if it is performed for a medical condition or procedure which is performed to the patient, it should be, the code should be assigned together, not separately. Immunizations, injections require two codes, one for the procedure, that is injection, and one for the medication, that is the vaccine or toxoid given to the patient. So that should also be claimed, right? So these things or the services or procedures, whatever provided under immunization, should be categorized under two category. One is procedure, another is medication. Now, how should we use CPT? So become familiar with the guidelines and notes for each section of the CPT book. Find the procedures and services provided by the office. Determine appropriate codes and modifiers. Enter codes and modifiers on CMS 1500 form. That is a kind of claim form. Now, locating a CPT code in the dictionary. How will you do that? Locate services documented in the report. Then after locating that services, what is provided to the patient, look up procedure codes in the alphabetic index of the CPT manual as per the reported services, and you need to identify that it is falling under which category, whether category 1, 2 or 3. Then if you remember, I discussed under category 1 also, we discussed 6 sections, right? Evaluation, then surgery, then pathology, laboratory, medicine, under which category that particular service is falling. And accordingly, you will open up that dictionary and find the code. See, in medical coding, guys, this is very important to understand thoroughly that how should we use this dictionary. That is the thing what we need to learn in medical coding. And second thing, with the practice we have to learn to find code faster, because for certification when you attempt different types of examinations, at that time you have to be faster in finding codes because it's a time bound exam, right? So anyways, in the company also it is time bound work or profile. So that's the reason we have to look into the, I mean, we have to practice in a way so that location of the procedure or services provided or any disease what is reported in that patient report, you should be very much thorough with the anatomy physiology so that immediately you should be able to find that from the report. And whatever you have found, you should be thorough with the dictionary, that accordingly you can cross check that particular procedure, service or disease in the corresponding dictionary, and accordingly you should be able to assign the code for it in the given form. So that's how a medical coder have to be expert with the dictionary as well as with the anatomy physiology for locating the or understanding the document provided to them, that is the report provided to them, and immediately able to locate diagnosis or procedure and services. Coming to the last, sorry. So look up the procedure or code in the alphabetic index of the CPT manual and then determine appropriate modifier also. It is important to look for modifier and then carefully record procedure codes on healthcare claim and then match procedure with the diagnosis. Then coming to the next type of coding, that is HCPC, HCPS. This stands for Healthcare Common Procedure Coding System. Healthcare Common Procedure Coding System, that is HCPC, commonly pronounced as HCPC, are set of codes based on CPT codes only. Now, these were developed by the CMS, that is Center for Medicare and Medicaid Services, and the same organization that developed CPT and maintained by AMA. So this means HCPC is also maintained by AMA and it is organized by them only. HCPC codes primarily correspond to services. I mean, for what purpose we are using this dictionary? So we are using it for services, procedures, and equipments. Those services, procedures, and equipments which has not been covered by the CPT codes. Now, this includes durable medical equipment, prosthetics, ambulance rides, and certain drugs and medicines. Now, HCPC is also the official code set for outpatient hospital care, chemotherapy drugs, Medicaid and Medicare, among other services. So we are having here two types of term, outpatient, inpatient. Any patient who has been admitted for more than 24 hours in the hospital, we consider them inpatient. While some patients who are visiting the hospital or maybe admitted also, but less than for less than 24 hours for providing certain services, so those kind of patients we consider as outpatient. So HCPC is official code set for outpatient hospital care like chemotherapy drugs, Medicaid and Medicare related any kind of if claim is coming among other services. The HCPC code set is divided into two levels. First of these level is identical to the CPT code that we covered earlier, and level 2 is a set of alphanumeric code. Level 2 is a set of alphanumeric code like ICD, if you remember, the ICD-10 that is divided into 17 sections. Now, each based on an area of specificity like medical and lab or any rehabilitative services if provided to the patient. So we will look into detail about the HCPC codes under different levels. Level 1, as I told, it is similar to CPT codes. So there are 5-digit numeric codes contained in CPT 4 published by the AMA. It describes physician and hospital outpatient procedures and services provided to the patient. Level 2 are the national codes. These are alphanumeric codes which are assigned by CMS. These 5-digit codes begin with an alphabetical character like ICD-10. And A to V code I discussed earlier in the CPT also. A to V and I mean the add-on codes and V codes are also there. And these are used to report services or supplies that include ambulance, dental, medical, and other unique services, any other supplies if it is provided to the patient, and drugs or procedures not included under CPT-4 dictionary. It includes codes for non-physician procedures also, such as like any ambulance service provided to the patient for bringing them or dropping them to the home or bringing them from the home to the hospital. So durable medical equipments, specific supplies, and administration of injectable drugs. You people know that during surgery many instruments are also used, so that should also be covered when any surgery is happening for the claim, right? So those things are falling under these categories. Then local codes are there. These are also alphanumeric codes which are developed and assigned by the local Medicare carrier or fiscal intermediary. Local codes are again 5-digit codes, alphanumeric codes using the letters S and W through Z. These local codes are used to denote new procedures or any specific supplies for which there is no national code available. Okay. Or could be under the research process, that particular procedure, whatever provided to the patient. So we have completed till now that what is medical coding, what all different types of medical codings are there, under those types of codings, what all, I mean, how to locate codes, what are the different ranges, what are the features of those codes. These things we have learned till now. Now we will talk about coding compliance. So compliance with the federal and state law and payer requirement is mandatory. This involves diagnostics and procedures. And when I'm talking about diagnostic and procedure, I hope many people will agree with me that when any patient is going to the hospital, the diagnosis and the procedures, whatever provided to them, these are linked together, right? So there is code linkage between the assigned codes for a patient's medical condition, whether it is under diagnosis or under the procedure, whatever services, etc., provided to them. So, a process used by insurance company representatives to evaluate the necessity of the medical procedure reported based on the patient's diagnosis. Okay. Now, procedures prevent errors in coding and incorrect billing by careful attention to details. Okay. So, this is what considered under code linkage. Now, you people must be aware that insurance companies, whoever paying sometimes huge amount for patients treatment, uh, there are many frauds in that, right? So to prevent or to avoid such frauds, what all things should be taken care, and usually what kind of patterns are there in these frauds, we will look here. Investigator look for patterns such as, I mean, this investigator is different from clinical research investigator. These are the investigator who are actually verifying that whether the claim is genuine or not and required for payment or not. So in that case, whoever are the assigned investigator, or we can say sometimes auditors also, they look for patterns such as reporting services that were not performed, then reporting services at a higher level, then performing and billing for procedures which are not related to the patient's condition and therefore not medically necessary for payment. Billing separately for services that are bundled in a single procedure code. Then again, it is something which is fishy, which is required to be investigated. Reporting the same service twice. So again, it is not like sequel is not possible, but coding should be provided under the sequel kind of codes and descriptions. But it is mandatory that such kind of conditions, if it is falling under sequel category, must be investigated properly. Now, we are having various guidelines, which is there to find accurate code, to prevent any kind of coding error, thereby preventing delay in the payment part from the insurance company or billing. So such kind of things are there and guidelines are there which we need to take care about. So the purpose of the coding guideline is to provide timely directions for accuracy and consistency in coding and to promote uniformity among hospitals in reporting ICD-9 CM coded clinical information, or as present we are using ICD-10 CM coded clinical information. The task of re-examining coding guidelines to ensure that they are clear and complete, and of developing additional guidelines where they are needed has been assigned to a subcommittee of the Coding Clinic for ICD 9CM Editorial Advisory Board. The seven coding guidelines appearing in this issue have been reviewed by the Editorial Advisory Board and have been approved by all members of cooperating parties, that is American Medical Record Association, Healthcare Financing Administration, National Center for Health Stats, and American Hospital Association. To the central office on ICD 9CM, presently ICD 10CM use, so we can include that also, maintained by American Hospital Association. ICD 9CM, why it is mentioned? Because in some of the companies, yet they are using ICD 9CM codes for certain reports, not for all, for certain reports, depending on different types of project what they are receiving. Okay, and for from what timeline they are receiving. So yes, they can use ICD 9CM. It is for the older version, if it is for the older version. Now, for compliance of such guidelines provided, uh, there should be certain plan. So what all plans we can use? Not all mentioned here, but yet maximum given here. We can consider like medical offices establish a process for finding, correcting, and preventing illegal medical practices. Then goal of the compliance plan is to prevent fraud and abuse, ensure compliance with applicable laws provided, help defend physician if investigation occurs, right? So whoever, it should not be like a genuine physician got stuck with giving wrong treatment or providing wrong report for the claim purpose. So in a way, we can protect physician also using these compliance plan. Also, plan demonstrate to payers honest, ongoing attempts to correct any weak areas of compliance, if any. Plan is also developed by compliance officer and committee who also undergoes audit and monitor compliance, develop written policies and procedures that are consistent with regulations and laws, provide ongoing communication and training to staff, respond to and correct errors. So all these are there under the compliance plan, which will be covered. And these are certain goals of the compliance plan, what we discussed here. Now, coming to the very important part of this whole presentation is what kind of skills required by a medical coder. So the thing is, a medical coder must be very much thorough with the medical terminologies. Why? Because once we receive medical reports, uh, one thing we have to talk about, that is our speed, right? Because in a day around 30-40 reports you have to handle. So for a fresher, if I say around 20 reports, so that is on an average in the industry in different companies. So that's the reason, if you do not understand medical terminology and anatomy and physiology basics, you will keep on looking in the Google, which is not a right practice. That's the reason it is expected whoever is the one selected as medical coder must have thorough knowledge of human anatomy and physiology and medical terms, whatever are there related to disease or diagnostic and procedures, whatever are there. Then analytical skills must be there when they are going through the reports. They must have a good knowledge and understanding of the different types of dictionary what we are using for medical coding, like ICD-9, 10, CPT, and HCPC, and how to code. They must be knowing that. Then various guidelines are involved here, like LCD and NCCI guidelines are there. This thing should be there. I mean, a coder should be having knowledge of these guidelines. Apart from that, HIPAA compliance. So HIPAA is the act, as I told in the first slide only. A coder must be able to comply with all the HIPAA guidelines provided to them. Medical billing concepts. So it is not like necessary that a medical coder must be aware with the medical billing process and guidelines, etc. But yet, a coder must be, I mean, because these two teams are there who are working in collaboration, in coordination with each other. So possibility is there that if any claim is made by the coder, I mean the assigned medical code assigned by the coder is rejected by the billing team. So it will again come back to you. as a coder. So that's the reason you must be having a good knowledge about the certain medical billing concepts also. Detail oriented and self motivated coders must be having a keen to learn about the details whatever are there in the patient's report. Okay, so next is about who can pursue this medical coding. Basically, any person belonging to life science background, who are graduate or postgraduate, or coming from pharma or medical background, can go for this medical coding field. Like any medical or paramedical and science graduates and postgraduates, uh, any MBBS, BAMS, BHMS, BDS, all these people, then pharmacy people, nursing people who are doing their different types of courses, and then physiotherapy, BPT and MPT people, they can also go. Any person who is having a degree in or PG degree in biotechnology, microbiology, biochemistry, zoology, anatomy, physiology, genetics, cell biology, health education, chemistry, biomedical, they can go for this particular field, that is for medical coding training and looking for the job into this. They can go for this job. Now next is the medical coding certification. So different types of certifications are there. Basically what happens, a medical coder starts with advanced certification from different institutions, then they look for other certifications which is recognized and provided by other different bodies of US basically. Now, these certifications are internationally recognized certifications, and for clearing this, I mean, for getting these kind of certification, there are certain examination. I will talk about that also, which are required to be attempted by the coder, and to qualify those examination, and after that you will get that certification, which is having certain time period of validity, after which there is a requirement of renewal of that particular certification. So basically, what are different types of certification? I'm not talking about all, but the basic certification are provided by the bodies like AAPC and AHIMA, that is AHIMA. These are the two of the top professional organizations which are granting medical coding and billing certifications. Uh, Apart from that, if I talk about specifically AAPC, so by far the largest organization of the coders is the American Association of Professional Coders, that is AAPC. AAPC offers general and specialized medical coding and billing certification. Now, a general certification is the best place to start as a new medical coder. AAPC certified professional coder, I mean, the certification what is provided through the AAPC is known as CPC certification, that is certified professional coder. Exam, I mean a person who wants to have this certification, they have to attempt that exam, remain the most popular certification in this field. Now, the American Association of Professional Coder recommends that all the persons interested in this CPC exam have an associate degree. And this general certification covers several different aspects of the coding profession, including diagnostic code, procedure codes. I mean, you have to be thorough with all such kind of coding systems when you are willing to attempt this CPC exam organized by AAPC body. Here, one thing is important to be taken care, that most of the time people having certain certification and start working in any company, for them it becomes very easy, because while working only they will learn, and they will maintain their speed of coding um, uh, through the different dictionaries, which actually helps in clearing this CPC exam. So this is a general certified cover that covers several different aspects of the coding profession, including diagnostic codes, procedure codes, for over a dozen specific fields. Coding guidelines also covered under this, where any person who want to attempt this exam, they have to be thorough with all the guidelines, medical terminology, and many other things. AAPC also offers four other core certification options. Apart from this certification, AAPC is offering other certifications also, including certified outpatient coding, that is COC, certified inpatient coder, CIC, certified risk adjustment coder, that is CRC, and certified professional coder payer, that is CPC. American Health Organ Information, that is AHIMA, a management association, is another large professional organization for coders like the AAPC, AHIMA offers a number of medical coding and billing certification options, including the certified coding assistant. I mean, what kind of certification they are offering? I'm talking about that. So they are offering certified coding assistant, that is CCA, certified coding specialist, CCS, and certified coding specialist physician based CCSP. So most of the people, they attempt CCS certification through AHIMA. A bit tougher. I mean, AHIMA is a bit tougher compared to AAPC competition. Please mute from your side.
काय काय
Okay. Now, what are the different career opportunities are there in the medical coding field? So certified coders are high in demand throughout the healthcare industry. Nowadays, you people can see many different kind of health conditions are there for which different treatment and procedure and diagnostics are required. That's the reason there is a huge demand in the market in healthcare industry. Healthcare or IT companies, they are also, I mean, they have also started side by side certain departments which are dealing or which are requiring medical coders. Hospitals or clinics, insurance firms, medical coding executives, medical coding specialists are there, coding supervisors, coding consultant, compliance and audit specialist, compliance officers, medical record supervisor, insurance specialist. These are some of the designations or levels I'm talking about, but many more things are there in which a particular coder can work, and especially if they are having certifications. So after getting those certifications, you can start working in these industries at different positions and levels with different kind of packages, okay, different range of packages. So that depends again, depending on your qualification, your uh, I mean, how you have performed in the interview, what kind of certification you are carrying. Like if a CPC coder is there, obviously their payment is very high. So that's how it happens. Now, one thing lastly I would like to add here, you people must have seen that whenever you will look for the job profile in the market, you will find they need specific coders belonging to EM department. I mean, EM coders like evaluation and management we have seen. Then the one who is belonging to surgery or medicine. So this is because for that particular department related to related to which various reports have come as a project in that company, they are looking for coders, okay? Or some companies, they are generally selecting or recruiting medical coders whom after selection they segregate in different departments. That is also a way of recruitment in the industry.
For more details, connect us on given details on screen. And don't forget to follow us on our social media. Thank you.